Good morning and welcome to the Great Lakes Health Radio program on the legendary Power 96.5 1080 AM WAFO. I'm your host, Francesca Messiah from Kaleida Health, and we are so happy that you're able to once again join us on this very exciting learning venture of the Great Lakes Health radio program. Our topic for today, I'm just skipping over a little bit because I know I normally say, I always mention who Kaleida is, and I'll mention who Kaleida is before we get into our topic. I'm just so excited about our topic. Kaleida Health, we are the hospitals. We're Buffalo General Medical Center, Gates Vascular Institute, Oshai Children's Hospital. We have several clinics. We are Millard Fillmore Suburban. Also, we have the Visiting Nursing Association. And like I said before, several health clinics located throughout not only Buffalo, but in Tonawanda and Amherst. And we serve all ages. We serve moms who are expecting, who are pregnant, and we serve the oldest member in your family, and that's with the Visiting Nurses Association. Today, we're going to talk about something that we have talked about before, and that is our Great Lakes Cancer Care Collaborative. And our guest for today is Melissa Wasner. Good morning, Melissa. How are you?
I'm great, Francesca. Thank you for having me today.
And Melissa, could you just share with the listeners, what is your title?
Sure. So I work for Great Lakes Cancer Care Collaborative as the Oncology Survivorship Program and Outcomes Manager. And I'm also a professor in the Communication Department at Canisius College. So my role at Great Lakes Cancer Care is to offer a robust programming for cancer survivors, to offer, a range of services and resources for survivors, and to assess those services and make sure that they are meeting the needs of our patients.
Thank you. And I also want to mention you also have your PhD in education. I know you worked hard for that. So I just want to make sure that our listeners know that our guest is well versed in this topic for today. And our topic today, I know everybody's been hearing about it for years, and I'm so glad. And what is October? October is Breast Cancer Month. And our topic for today is not only breast cancer and the Great Lakes Cancer Care Collaborative, but it's also breast cancer and surviving breast cancer. I'm sure many listeners know of someone who has had breast cancer. Matter of fact, our listener, may have had breast cancer, but you know what we hear now? We hear about survivors. And so today we're going to be talking about both of those topics with Melissa. And Melissa, let me start. Although just about everyone is aware that Breast Cancer Month is celebrated in October. Our football players wear pink, our elected officials wear pink. You see more men in pink, I would say, during the month of October. But is this topic still relevant? And is breast cancer only affect women? So I should say, why is this topic still relevant to everyone?
Right. So first, another piece of information I want to add about myself is that I am also a former breast cancer patient, right? That I have been, I was diagnosed with breast cancer in 2016. And I feel very fortunate, very thankful to be here today and to be able to talk to you about this topic. It's one that's very personal to me, right? It's very with my personal experience with breast cancer. So I think this is a great way to start this conversation is, why is this topic still relevant? Like, are people getting tired of this, right? Well, and here's how I would answer that, right? I am tired of it because of the numbers, the sheer numbers of women and men who will be diagnosed with breast cancer. that we are doing better in terms of diagnosing and treating, but there's still, the numbers are still there. And so, for example, according to the American Cancer Society, female breast cancer has surpassed lung cancer as the most commonly diagnosed cancer worldwide. And breast cancer accounts for 30% of newly diagnosed invasive cancers in women. And to your point, Francesca, right, about in 2022, 287,850 women will hear the words "you have breast cancer," and 2,710 men will be diagnosed with breast cancer. So, is it still relevant? Is it still important? Absolutely. And I think all cancers are important and relevant. And, we identify, different months where we talk about these different cancers, but October is a very important opportunity. I'm going to use that language, an opportunity to once again remind people that the numbers of individuals, 1 in 8 women will be diagnosed in their lifetime with breast cancer. The numbers are staggering.
Yes, and I want to say I am so glad that you survived. I'm just very, so let me say, yay, congratulations, you beat cancer. And again, and on a personal note, I want to say my sister who passed away in March did not beat breast cancer, although she did survive for a few years. And it seems very surreal this month, this time around, talking about breast cancer, because it makes me come to reality that that's what my sister had. So, but she did survive for several years, and but I want to say to you, Melissa, yay, congratulations.
Well, thank you for saying that. But I will say this, that this is the reason we still have to talk about it, that many women are not surviving breast cancer, that it is a horrible experience, from a patient. I'll speak on the patient as my patient role. It's really unpleasant. And I think that this month is an opportunity, right? I describe it that way, for us to remind people that not all women will survive this. And that we've made progress, absolute progress, but it's still important for us to recognize that not everyone will survive this illness. It's very unfortunate, and I'm sorry about your sister.
Yeah, no, thank you. Yeah, no, thank you. So thank you. Let's talk more about Great Lakes Cancer Care. Where are they located, and to find out if for their annual mammography?
Yeah, so that is a great question that I get often. Tell me about Great Lakes Cancer Care Collaborative, right? So Great Lakes Cancer Care Collaborative is just that, right? It is a collaboration between the region's cancer experts. And so a number of organizations came together. And how are these organizations all unified? How are they united? They share the common goal of treating cancer patients. So Great Lakes Cancer Care Collaborative utilizes what we describe as a comprehensive integrated team of cancer experts. And these are experts to your point, right, your question, through all stages of your cancer, right, experience, right? So from diagnosis through treating breast cancer to after breast cancer and survivorship. So, for example, a patient who is, has been recommended by their OBGYN or their primary care to go get diagnosed, right? So, and I'll just walk through, right, some of our affiliates, some of our members and our services to be more explicit. So at diagnosis, maybe you need a mammogram, or you need an MRI or follow-up imaging, an ultrasound. One of our members would be Great Lakes Medical Imaging. Right. So, Susan is recommended to have this test. And so she goes and has her mammogram, and then she needs additional follow-up tests, maybe an ultrasound. because she has dense breast tissues. And then they find something, unfortunately, right? And so then that Susan might go for a surgical consultation, and she might see someone like Dr. Studi Tambar, right? And she is at our Spindrift location, right, in Williamsville. And then from there, she might need she might need to have chemotherapy, right? And so she might see one of our medical oncologists who is also at our Spindrift location. She might need radiation. And we know that Cancer Care of Western New York, who is also one of our members, is part of this group, this collaborative or integrative care. And, perhaps she might need this person might need pain management or some consultation about managing post-surgical pain. And so that Susan could go to the ECMC Ambulatory Care Center and see Dr. Stucci. So this is just a very quick snapshot of some of the services that all fall under the Great Lakes Cancer Care Collaborative umbrella.
And what I like about what you just said, you mentioned sites that were in the suburbs, but you also mentioned sites that were in the city on a bus line. Although many times, I know when you have, if you have cancer, you may not want to catch the bus. Sometimes you might have to catch the bus for treatment. But if you are driving, you have mentioned, and that was my question, sites located both in Buffalo and in the suburbs. What if someone right now has a question? Do you have a phone number they can call for more information?
Two pieces of information I think that are really helpful. I will always send people to our website, which is www.greatlakescancercare.org, right? So that's greatlakescancercare.org. And then our phone number is 716-884-3000. And that number, right, is kind of the hub in terms of, I need help with, right, diagnostic. I need help with a surgical consultation. I need to know about, different, right, locations. You bring up that point, right? So I would suggest to call the 716-884-3000 number. And then obviously, the different places that I mentioned have locations in sight. The nice thing is that if you go to the Great Lakes Cancer Care website, that's going to give you an overview of all of our doctors. It's going to give you an overview of all of the different types of cancers. And then to your point, Francesca, is going to tell you where these, where you go, right?
Oh, great. Yes.
You go to Cancer Care Western New York, you go to ECMC, you utilize Great Lakes Medical Imaging, and all of that information is on our website.
Oh, okay. No, that's wonderful. And you know what? Before I go on to the next question, isn't there a screening event coming up in October that's sponsored by Great Lakes Cancer Care?
Yes, there is. That screening event is on Saturday, October 15th, and it's 8 to 12. It's at Great Lakes Medical Imaging, 199 Park Club Lane, Suite 300 in Williamsville. And they are giving out gift bags, and they'll have light refreshments. And if anyone wants to schedule a mammogram, the number,
please call. Yep, please call.
716-836-4646.
And could you say that one more time?
716-836-4646.
And for those of you who aren't sure where Park Club Lane is off of Main Street, over by Lenova Pizza, Tim Hortons, if you know where Chico's is, and it's a street that's really behind Tim Hortons, Park Club Lane. And it's right past Kensington. If you're on Main and Kensington in Williamsville, you go over the thruway. There's a thruway. You pass that. The first street at the traffic light is Park Club Lane. And if you're coming from Buffalo, you take a left, and it's like in the middle of the block, and it'll have balloons and such. So you'll be able to find it easily. Thank you. And so something else that I have another question. For years, medical professionals have encouraged women to do self breast examinations, and I know, and I have to say, I have a young woman, African American woman. I would say she's probably in her late 30s, early 40s, who recently did a self breast examination and found a lump. And so, but is it? But someone said, or I heard on the news, that they're encouraging women not to do this. Is this true?
Okay, so I'm really glad that you asked this question because there's a lot of confusion around this. So I'm going to my go-to for anyone listening out there, as far as go-to information, is always going to be the American Cancer Society, right? Their website is an excellent resource. So if you need up-to-date, current best practices, go to ACS. So according to ACS,
which is American Cancer.
Yeah, the American Cancer Society, right. So I would always direct people when people ask me, for what are symptoms or what is the best treatment, I direct them towards the ACS website. But to your question, which is a great one, a really good question, because there's a lot of confusion, as we said. The problem is that the research, everything is evidence, clinical evidence-based, right? So evidence-based. So is there evidence? Is there clear, definitive research, without a question, that shows that self-exams lead to, right, diagnoses? And that's the problem. So research has not shown a clear benefit of regular physical breast exams done by either a health professional or by women themselves. So that's the challenge. What happened is there's very little scant evidence that these tests are helping women to find cancer early when women also get screening and mammograms. So most of the time, breast cancer is detected because of a symptom, right? A symptom like a lump the patient presents with a lump in their breast. And that woman probably discovers that lump when she is either getting dressed or she's in the shower. And so it's not that she's discovering that during a self-exam, she's discovering it right when she's doing something else. So the recommendation is this, and I want to be clear about this because I agree with you. There's a lot of confusion. Women should be familiar. They should be familiar with how their breasts normally look and how they feel, right? So that familiarity is important. Is there asymmetry? Is there something new that you see or observe? That's what you need to talk about with your OBGYN, with your primary care physician, right? So while the ACS does not recommend regular clinical exams or breast exams as part of a routine breast cancer screening schedule, what they do say is that it does not mean that these exams should never be done. In particular, when women have higher than average risk, right? When women have a higher than average risk, they present with some of these risk factors, then healthcare providers will still offer clinical breast exams, and they'll, give some directives in terms of early risk and detection. And some women, and this goes back to being comfortable, and I think the recommendation is, right, too, that if you're comfortable doing regular self-exams to keep track of how your breasts look and feel, then you should, right? Then you should. But I think that they pull back at making this a mandate, right? And the reason that they don't mandate it or require it is because the evidence doesn't support that this is routinely helpful for women who are at average risk of breast cancer. Does that help? Does that clarify?
It does. It does. So, to me, it almost sounds like that, it's a combination. Still get your breast examination, but if you think you find something, go, see your doctor and check and have it checked out.
Absolutely. And the only way you're going to find something, to your point, is with you being familiar with
Right.
what the baseline is. What's your baseline? What's your normal? And
Right.
so that
Yes.
means you do have to at least familiarize yourself by, checking in the shower, checking after making sure you know what your breasts feel like, you know that what the normal is, so that if something is abnormal, you report that.
Mm-hmm. Yeah, and getting ready for this program, of course, I was reading up a little, reading up on the topic, and if your mother, especially if your mother or your grandmother have had breast cancer, is it recommended that maybe the men and women go get an examination, even if they're, let's say, if they're 35 and their mother and grandmother had breast cancer and they're 35 years old? Is it recommended that they should go to and ask their medical professional for an examination?
Well, and this is something that I think all women will, who see their doctor regularly, their OBGYN, their primary care, they fill out their medical history, right? It's important to have that conversation, right? To know your medical history, because family history of breast cancer is in fact a risk factor. So if you have you have certain risk factors, then your OBGYN will make recommendations based on those risk factors of when you should start your mammograms, right? So that's something that, to your point, it's really important. It's absolutely important, right? To be familiar with your breasts and know what they feel like and know what normal is like. And also to know your history, right? To know who in your family has had history, because I distinctly remember going in and filling out that medical history tree and showing, who has had cancer in my family. And it certainly is identified by ACS. Family history of breast cancer is in fact a risk factor.
I know we are running out of time, but I want you to talk about the support that you felt was most helpful to you as a survivor, and the support of a cancer survivor given by the Great Lakes Care Collaborative.
So one of the things that we do is that we look at, right, the patient across the whole the whole cancer experience, right? So diagnosis, active treatment. Right now you've completed your active treatment. And this is most of the time when you've completed your active treatment, most of the time that's when you fall into a survivor, right? This category, right? And there's been research that talks about adding this new stage of transition, right? So transitioning to basically the new normal. So you've completed your treatments, your surgeries, and now you technically are identified as a cancer survivor. And so at Great Lakes Cancer Care Collaborative, we have cancer survivorship services and resources. So we have, for example, we have someone who is in survivorship who gives our patients survivorship care plans or treatment summaries. And these summaries we found are really important to help people understand, here's what happened to you, here's how you were treated, and here's what should happen next. And the great thing about these cancer survivorship plans is that they can be shared with your primary care. So you can give this document to your primary care doctor, and now they have information about what cancer medications, what treatments you had, and what some things, some health problems that might occur as a result of your treatment. So that's one facet of survivorship. Other things that we do, we're having nutrition. We know that one of the goals, right, is to help people who have had cancer live healthy and full lives, right? So how can we do that? So nutrition. We have a nutrition seminar tomorrow at ECMC, and we have one today at ECMC, at 3:30, and we have one tomorrow at 6 o'clock at Spindrift. And these are free seminars for our patients who are finished with active treatment to learn about eating healthy after cancer. What should I eat how should I approach my diet and exercise? We'll talk a little bit about exercise so that I can extend my health, right? So I can stay healthy. We have emotional support groups, right? We have emotional support groups the last Tuesday of every month from 6 to 7 at the Wellness Center at DeGraff Medical Park. So we have an emotional support group for all all types of cancers, right? So it's not breast cancer specific. It's for anyone who needs to have a conversation and receive support around their experience with cancer.
And Melissa, and can I jump in? And people can bring, the survivors can bring a family member or a good friend with them, right?
Yeah, absolutely. And that I'm so glad you pointed that out, because I've had a lot of people message me and say, can I bring my spouse or my sister? Absolutely. And I think that's really great. And your question was what was the most helpful, right? So I actually, as a researcher, I studied this with one of my students. We studied kind of the most helpful and least helpful things that you can do, right, to support people who have gone through a cancer diagnosis. So one of the biggest things, I'm going to just emphasize this, the power of we, right? The power of we saying that to the person, we are going to get through this together. We are here for you. We will go with you to chemotherapy. We will go and wait, in the waiting room after your surgery. So that's something I will tell you came through very loud and very strong. And just remember this, right? The power of we, that getting diagnosed with cancer is very isolating. You feel very alone. But if you have people around you who are saying, we are here, we are going to support you, that is incredibly powerful. It's impactful for these patients. And that was recognized a number of times.
I love what you said, talking about the power of we. And I want to thank you so cancer is a family, and the friends that you love, it is we know it impacts everyone. And please don't do it alone. At Great Lakes Cancer Care Collaborative, as Melissa said, there are all kinds of support groups, there are support teams, there are nutritionists. Please do not do this alone. And on that note, Melissa, I want to thank you for being our guest this morning on the Great Lakes Health Radio program.
Thank you for having me.
Yeah, and this isn't our last conversation. We just ran out of time.
No problem. Thank you for having me.
Thank you. And I want to thank our listeners for listening to us this morning, and where our topic was breast cancer and breast cancer survival, and talking with Melissa from the Great Lakes Cancer Collaborative. Next week, you'll hear my esteemed colleague, Cindy Bass from ECMC. And until then, God be willing, I'll be with you in 2 weeks. This is Francesca Messiah from Kaleida Health. Bye-bye.